Greetings, everyone, and welcome to another episode of Arthritis at Home. I'm Kelly Lenvoy, and today we're going to be looking at an important topic for patients everywhere, and that is the affordability of medications, which is a big issue for many people living with a chronic disease. One of the drivers of high costs for medications is the misuse of patents by original brand manufacturers to extend their patent, delay the competition from affordable, generic, and biosimilar medications. Joining us to talk about a launch of an international grassroots education campaign on pharmaceutical patents is ACE's own Cheryl Koehn. Cheryl, welcome.
Thank you very much. It's always a pleasure to be here.
So the campaign being launched, Patients and Patents, what is it and why was it created?
The Patients and Patents campaign, in full name, Patients and Patents, a grassroots educational campaign on patents, is a global grassroots initiative, Kelly, and it's led, as you would think, by patient organizations here in Canada, but also in the United States and Australia. Our co-leaders and partners in this campaign are the Crohn's and Colitis Foundation in the United States and the Australia Patient Advocacy Alliance in Australia. And our goal in this campaign, Kelly, is really educational. It's to raise awareness about, what pharmaceutical patents are, how they work, and then also how they can be misused and actually delay affordability of medications. So, many people living with chronic disease, Kelly, have no clue, or people in the public for that matter, have no clue about patents. They don't know how pharmaceutical patents, that they even exist, that how they work, why they're granted, and why they serve good. Patents are good. But when misused, patents can also have a negative effect on patients.
I'm going to follow up, maybe just dive a little deeper. What exactly is a patent and how does it work?
Yeah, so patents are things that are granted to a company that's developing a new medication, Kelly, and they can file for a patent at any point during the development process. The more they work on it, though, without a patent, the greater their exposure is that someone else will come in before them and patent what it is they're working on. So most companies file it very early on in the development process. And a patent is granted for 20 years. So whether you've gone through, fully gone through the research process and submitted it to a regulatory agency, let's say Health Canada, if you filed for a patent very early in the process, your patent life here in Canada, it's 20 years, starts ticking. Okay. So companies are really motivated to get their development job done very well, done to a level that Health Canada, scrutinizes and makes sure that the public is safe should they give permission for them to sell that patented product into the marketplace. And that patent, Kelly, is very important. Gives the company a limited amount of time, or a set amount of time, I should say, 20 years, to recoup their investment. And that's super, super important, because if they're not actually recouping their investment and making some profit, shareholders don't buy their stock, right? They don't have new monies going back into the development process for things that are exciting and life-changing and life-saving for patients, Kelly. So patents are very, very important. And then after the patent expires, that means other companies who make generic versions or biosimilars, if it's a biologic medication, can then come into the marketplace afterwards. And we all know that generics and biosimilars are significantly lower in cost because they don't have a lot of those upfront research and development costs. So patents are done, sort of, there you go. You've made all this money back. You've reinvested. You're developing the next new thing. And then the marketplace is open for competition.
And just for our audience to realize, when we're talking about research and development, it's a significant amount of time and money invested.
Yeah.
On average, it takes 10 to 15 years and approximately $1 billion to develop a new biologic. So this is high scale
High risk, high
and high
risk.
risk. Yeah,
Yeah.
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 Um, so when we're looking at uh, this this principle or this action of extending patent rights, um, how do certain companies execute that? How do they make that happen?
Yeah. So, that's when lawyers roll up their sleeves, Kelly, and they start making application to patent offices. There are lots of really legal, jargony sort of terms that are used when describing um, patent, let's say, manipulation or patent misuse. One of them is evergreening, where they file new patents for small and often not therapeutic changes to their product, um, like switching to a new injection pen or moving to what might be called a slow release formula.
Hmm.
They're small things, but legally offer a big bang for the buck because they extend the life of the patent, okay? Meaning the company keeps selling it even off patent on an exclusive basis. There's no competition because the patent office has granted an extension or evergreened, meaning pushed it out. There's things called patent thickets. And I'm always reminded of a big, thorny thicket when you're walking through a garden. And that's exactly what this is legally. And companies, by filing sort of dozens of overlapping patents, Kelly, they really work legally to delay entry of a generic or a biosimilar um, product into the marketplace. And, these kinds of legal tactics, Kelly, what they do in the long run is they work to create a monopoly. And and legally, it can be very successful. We've seen this in the arthritis field where products their patent has been evergreened or pushed back, or a whole flurry of lawsuits have been filed with patent offices that say, oh no, we've got all these things at interplay and you can't bring in competition. So the bottom line is, Kelly, these legal tactics um, keep patients and their insurers, whether it's public or private. Here in Canada, we have a publicly funded drug system, keeps prices for those patented products high at their original to market price. Meanwhile, technically, the patents are up. And it's these thickets, this evergreening tactic, those delay the entry into the marketplace of generics or biosimilars, which, as you know, can be sometimes as dramatically reduced in cost as 30, 50%, even 75, 90% if you're looking at a generic, right? So this is big money we're talking about here. And so while patents do a really important thing in the beginning, as that patent life cycle begins to end, you see companies who want to protect their blockbuster, for lack of a better way of putting it. They want to keep the profit train running. It's that simple.
So patients are paying the price,
And healthcare systems, yeah.
so what? Let's just start with patients.
Yeah.
How does it impact them? Why is this such a big deal for patients?
Well, Kelly, as a person living with rheumatoid arthritis, I am on a biologic. And I can tell you in the very early days before insurance was put into place, before public formularies began paying for them, people like me would drug share, right? We take fewer doses of it because we were trying to stretch out when we had to pay for it next. We're talking about products here, medications that cost $2,000, $2,500 a month, Kelly. So, people were doing all kinds of things to self-ration, self-limit to make it affordable while things were still under patent. And the net result of that, Kelly, is joint damage because I'm not taking the full dose or I'm not taking it in the intervals that it's prescribed at. Guess what? My disease isn't checked. It's not suppressed enough. You need to take these medications as they were developed, as they were approved by Health Canada, and patients often don't because they're trying to find other ways to stretch the value, but they're not evidence-based ways. So that's a problem. And then, trade-offs, Kelly. That's another significant thing that patients do. We can't pay for our kids' college. We can't save for their college education or pay for it as it's ongoing. We can't retire. We can't reduce our work hours because we need the money to pay for our medications. We can't pay our rent. We can't buy the quality of food that we need to have general overall healthy body. Like it goes from side to side of our lives, top to bottom, how this impacts us in terms of kind of real life, trying to make our lives work day to day.
You mentioned earlier that generics can be up to 95%
Mm-hmm.
less expensive and biosimilars 30 to 50% less expensive. Um, when we look at the healthcare system, what does it mean when public and private drug plans are losing out on those potential savings?
Well, let's use the B word, billions of dollars
Hmm.
in lost savings, Kelly, for public and private drug plans, right? Can do a lot of things with billions of dollars. You can reinvest them into new medications coming into the market. So in some ways, um, patent misuse kind of foils that, right? It sort of undermines the ability to keep a formulary on a private or public drug plan vibrant with new medicines coming in, which is very important to people living with both chronic and acute diseases. So billions lost in savings. That reduced money, Kelly, those reduced savings then, of course, reduce the ability for a hospital or a research center or new care type implementation. It impacts the entire system as well as patients, as I've already described. And because there's reduced money going into institutional or community or tertiary care, we have longer wait times because we don't have enough people staffing the services that are supposed to be provided. Or we don't provide the same amount of training and the quality of care goes down. So the ripple effect is massive when you hear the sucking sound of billions out of the healthcare system. That's what happens. And then lastly, I think is really important. And, we're a patient organization. We're not marketers. We don't run a big drug company. We don't run a government. But we know as consumers that less competition in a marketplace means there's less pressure on people selling an exclusive product to bring a price down. That doesn't happen unless you have competition, right? So the patent life cycle is really important to reinvestment and development and competition out in the marketplace. And that has a massive impact on the healthcare system.
So if patients or patient organizations want to learn more about the campaign or access any sort of reference documents, where can they go and how do they can get involved?
Yeah, so I know after this video plays, a link to the microsite for the campaign will appear. So people first and foremost can visit the site and learn more. On the site, Kelly, is a campaign, what we call toolkit. And it has this toolkit, super easy to use, all downloadable, ready to copy and paste into their own materials if they want in terms of an educational resource, or they can just turn it around and send it off exactly as we've provided it. But it includes a plain language overview. The patent vocabulary is twisted and complicated, so we try to kind of demystify it and put some of these terms in lay language. It gives a really nice overview of how patents work. There's a really straightforward question and answer document, like maybe some of the common questions that may have come up from this discussion, for example. People can go and reference that. There's a really nice front and back page infographic that's downloadable or shareable across the digital platforms they may run. And there's also a glossary of key terms. So this is that vocabulary. For patient organization leaders and their members, knowing the vocabulary that's being used is really important. It's the only way we can actually get our heads around this topic, which is a very complex one. And I want to shout out to all the IP experts who gave us their expertise in shaping these materials. So you can download that. You can share these across patient organizations. So we're going to be reaching out, obviously, as well as our co-leaders in Australia and the United States, to the people that we talk to on a daily basis organizationally. So our healthcare provider organization partners, our fellow patient organizations, so on and so forth. And then lastly, I think, Kelly, we hope this builds sort of a nice community. We want people to share kind of what's happening in their countries. And all of this, we hope, will lead into people taking action. So one of the reasons to tackle this complicated topic is because this is stuff that happens kind of behind closed doors in legal offices and at government. But we're voters, right? We have a very important voice in how these kinds of patent policies are shaped and what is being allowed or what shouldn't be allowed. We should have a say, because at the end of the road, these really big, complicated patent policies, Kelly, affect our everyday lives. And that's really why we undertook this project with our co-leaders, Crohn's and Colitis Foundation of America and the Australian Patient Advocacy Alliance. So we're super happy to be working with them, and we hope we build a much broader audience and partnership as the campaign rolls along over the next few months.
Thanks for that summary, Cheryl, and
Yeah.
thank you for walking us through. I think, a very complex topic, as you said, not a lot of patients are aware of, but it certainly seems to strike a sweet spot when it comes to ACE and our advocacy work on public policy priorities, in particular when it comes to fair and equitable access to affordable
Yeah,
medications. This is
yeah.
a really important topic.
You raised the word access a couple of times in your questions and in your comments. Everyone who's watching and everyone I hope who comes into contact with this campaign will realize that patents bring access, but patent misuse and manipulation can prevent access. So access is a really important point in all of this campaign. It's sort of one of those, as we jargonly call it in education, a pivot point, right? We want people to understand where good becomes, not so good.
Thanks for that,
Yeah,
Cheryl, and thank you for joining us.
yeah.
And thanks to our audience for watching today. We're going to be providing you more access to Arthritis at Home in the coming weeks. We look forward to sharing more arthritis news with you. See you in the next episode. Bye for now.